This educational video is brought to you by www.drowad.com.
LASIK is a procedure which corrects visual errors by creating a flap in the cornea, lifting it, and applying an excimer laser controlled by a computer on the remaining cornea to sculpt a new shape, either decreasing the curvature of the cornea to correct nearsightedness or increasing the curvature of the cornea to correct farsightedness. The flap is then repositioned back to its place, where it heals by itself. The reshaped cornea allows the light rays to focus more accurately on the retina. In preparation for surgery, contact lenses should be removed at least 3 days before the procedure and sometimes up to 1 to 2 weeks, depending on your doctor's recommendation. Also, avoid wearing eye makeup starting the day before the procedure. During LASIK. During the LASIK procedure, you will be lying down at all times and looking up at the laser system positioned above your face. Anesthetic drops will be used to numb your eyes and make you totally comfortable throughout the procedure. A small device will be inserted between your eyelids to prevent you from closing your eye. You will be asked to spot a blinking light. You will then feel a pressure over your eye and vision might become dim or even black out for several seconds. Try not to move during this time. Vision will come back right after. When it's time for the excimer laser to work, you will be notified and you will be asked to look at the blinking light at all times. Rest assured, the laser will follow your eye in case it moves and will completely stop if your eye moves far out. Once you look at the light again, the laser will continue exactly where it left off. Looking at the light, however, will ensure uninterrupted, smoother treatment. The whole procedure will take around 5 minutes per eye. After LASIK. First day. After the procedure, you need to wear transparent plastic eye shields all day long for the first day, and then during sleep for the first week. Try to keep your eyes closed as much as possible for the rest of the first day. This will ensure adequate flap healing and maximum comfort. Use antibiotic drops and steroid eye drops 4 to 6 times equally spaced for the rest of the day, depending on your doctor's recommendation. Additionally, use lubricating drops every few hours and as needed. Second day and first few weeks. On the second day of the procedure, you can resume normal activity like driving, reading, and computer work. You need to keep your sunglasses when out for 1 week. You will be using antibiotics and steroid anti-inflammatory drops 4 times a day each, and lubricating drops every few hours and as needed. Always allow 5 minutes between any 2 consecutive drops. When instilling eye drops, try not to press on the eyeball. Instead, chin up, pull on the lower lid, and instill a drop in the cul-de-sac between the eyeball and the lower lid, or directly on the eyeball. Afterwards, close your eyes for several seconds and avoid excessive blinking as it decreases eye drop absorption. The eye drops will later be tapered and stopped according to your doctor's instructions, but the lubricating drops can be used as needed for several weeks to several months. Visual fluctuations are not uncommon for the first few weeks and even months sometimes, especially when staring, reading, or working on computers. Visual fluctuations gradually improve with time, especially with frequent lubrication. Lubricating drops come in small unit doses as there are no preservatives in them. You can recap them and reuse them several times as long as you throw them the same day. Do's and don'ts instructions include wearing transparent plastic eye shields while sleeping for the first week and avoiding eye rubbing for 1 month, minimizing direct water contact like splashing your eyes while washing your face or showering for 1 week, and avoiding swimming for 3 weeks. Additionally, no eye makeup should be applied till after 3 weeks. In summary, visual improvement after LASIK is fast, and patients can see very well by the next day as they can drive and go back to work. Additional visual improvement occurs within a week or 2.
Find more educational videos and patient information material at www.drowad.com.